I was diagnosed with bipolar disorder when I was in college. It wasn't just ups and downs. It was my whole life. I struggled with school, relationships, and keeping a job. I was prescribed medication early on. It took me a few years to start taking it consistently, and it really helped me. I got back into school, and I did well.
For a while, I juggled a lot of projects at once, and only sometimes felt depressed. But suddenly, in my mid-20s, everything really unraveled. I felt out of control, and sometimes I thought about killing myself. Eventually, I couldn't keep it up. I had to get some help, and I started to take medication. After I got used to it and learned what it did, it helped me manage my life and really start using what I learned in counseling.
These are the voices of people with bipolar disorder whose treatment with medication helped them manage their symptoms. Bipolar disorder is a condition where people have periods of time that they have incredible energy, don't need much sleep, and are really productive. People also have racing thoughts, they talk really quickly and are hard to interrupt, and euphoria, which means everything feels really, really great. These periods are called mania if they are really getting in the way of a person's life, or hypomania if they are not as severe. Depressive episodes also happen in bipolar disorder, and people can have depressed mood, can't get motivated to do anything, sleep too much, don't get any pleasure from activities, and even have thoughts of suicide. These symptoms impact people's relationships, employment or school success, and overall ability to manage their day-to-day lives. Bipolar disorder is often treated with a combination of therapy and medication. The prescription medications that are used are best understood as long-term treatments and need to be taken even when the person is feeling better. When first starting a medication to treat bipolar disorder, people usually undergo a trial phase, where they work with their doctor to determine the specific medicine and dose that will help. The most common medications for bipolar disorder are called mood stabilizers. These typically protect a person from feeling the extreme highs of a manic episode and the severe lows of a depressive episode. Mood stabilizers are not addictive, but can be dangerous if not used as prescribed. Working with a psychiatrist to determine a treatment regimen to minimize symptoms and maximize benefit is really important. Sometimes people take other types of medications, like antipsychotic or antidepressant medications, in addition to make a mood stabilizer even more effective. None of these medications are addictive, and it is important to work with a psychiatrist to determine the best combination of these medications for you. Medication for bipolar disorder, along with therapy, is the primary treatment for people living with symptoms. At first, treatment for bipolar disorder can be difficult. Some people miss how great they felt during the up of a manic episode, and the medications can have some side effects that people don't like. Working closely with a medical provider can minimize these challenges, and people can begin to feel that they can take control of their lives again. Ups and downs in life are common for everyone, but for people who have bipolar disorder, these ups and downs spiral out of control and become unmanageable, and even dangerous. However, with treatment, including medication, people can get help for their symptoms. They can find balance, and with that balance, hope.